Hello, I'm Garry Ho. I'm one of the board-certified and fellowship-trained sports medicine physicians here at OrthoVirginia. And what I'd like to talk to you a little bit about today are entrapment neuropathies, or basically unhappy nerves because they're being pinched. And we see this all throughout the body. Common places include pinched nerves in the elbow, on the inside of your elbow, often called cubital tunnel syndrome, or your classic carpal tunnel syndrome. We see it not just in sports medicine, but in what we often call our ergonomic athletes or our industrial athletes. So even though I'm a sports medicine physician, you don't have to be a classical athlete to see us in sports medicine. Life is a contact sport, so we love treating people of all walks in life. Pinched nerves can be really problematic. They can cause a lot of pain, burning, numbness, tingling, and there's a whole range of severities when it comes to pinched nerves. Lots of different ways to look at it. We certainly do a detailed physical exam and listen to your story to describe the symptoms. And those are important aspects to keep in mind when it comes to diagnosing your nerve problem. There are other tests that we can do as well: MRIs, ultrasounds, nerve conduction studies, and so forth. I do a lot of neuromuscular ultrasound so we can see the nerve very precisely in all the little details, but we also use it to guide treatments. And I'll talk about that in a moment. Thankfully, most cases of nerve entrapment are going to be mild, moderate in severity. And we could treat those with a combination of bracing and splinting, some nerve exercises such as nerve glides, and perhaps some medications. If they don't get better with that, before considering surgery, there are some other things we could consider. I do a lot of what we call ultrasound-guided nerve hydrodissections to release the nerve. And what that is to do a procedural treatment without surgery, where with ultrasound we can precisely guide the needle along the nerve, inject fluid to basically create space around the nerve, and peeling the nerve away from any scar tissue, freeing it up so that it's floating in fluid. A freed nerve is a happy nerve, and so that's what we try to do with the hydrodissection. And thankfully, we've been able to convert a lot of people who previously in the old days needed surgery into people who don't need surgery and get them back to their active lifestyle. So hopefully that's a little bit of information here. We also have a lot of surgeons that we can refer to if people don't respond to these treatments. But at OrthoVirginia, we seek to be able to take care of you in all severities of nerve injuries and other musculoskeletal injuries.